Gavin.
Okay.
Alright, so today I'm going to take you through the pre-exercise screening tool. Okay, the reason that we're doing this is to ask you a series of questions so that we can get as much medical information from you as possible. Okay, this will help me to determine if there's any contraindications to exercise. Now, there's anything that could be potentially harmful to you while exercising. Could be something as simple as a sore elbow or something as more serious like cardiovascular disease. Okay, once we've identified any contraindications, that assists me to establish an appropriate level of exercise or intensity that you can exercise at, and it will help me to determine what exercises to put into your program as well. So it's very important to complete this pre-exercise screening tool to also determine if I need to refer you for medical clearance before you commence exercise. Okay, so are you okay for me to go ahead with this today? Okay, great. Alright, I know your name, so just write that in. Birth, 2061, okay, now this is stage one. There's two stages, so I'll go through stage one first.
Yeah.
This stage is usually self-administered, but because I'm here with you today, I'll take you through this. And the aim of this stage is to identify those individuals with a known disease or signs or symptoms of disease who may be at a high risk of an adverse event during physical activity or exercise.
Yeah.
Okay, first question, has your doctor ever told you that you have a heart condition or have you ever suffered a stroke?
No.
Okay. Do you ever experience unexplained pains in your chest at rest or during physical activity or exercise?
No.
Okay, good. Do you ever feel faint or have spells of dizziness during physical activity or exercise that causes you to lose balance?
No.
Right. Have you had an asthma attack requiring immediate medical attention at any time over the last 12 months?
No.
Okay. If you have diabetes, type 1 or type 2, have you had trouble controlling your blood glucose in the last 3 months?
No.
Do you have any diagnosed muscle, bone or joint problems that you have been told could be made worse by participating in physical activity or exercise?
No.
Do you have any other medical conditions that may make it dangerous for you to participate in physical activity or exercise?
No.
Right, excellent. Okay. And because you've answered no to all of these 7 questions, you have no other concerns about your health, you may proceed to undertake light to moderate intensity physical activity or exercise. Okay, awesome. So I'll just get you to sign in. Okay, 15. Okay, excellent. Right, now we'll take you through stage 2 of the adult pre-exercise screening tool. And this is to be administered by a qualified exercise professional, which is myself.
Yeah.
And the aim of this stage is to identify those individuals with risk factors or other conditions to assist with appropriate exercise prescription. Just getting the details. Okay, and how old are you?
53.
53. Okay, and you're a male. Okay, because you're over 45 years old and male, we need to give you a risk factor of +1.
Yeah.
Okay. Family history of heart disease, for example, stroke or heart attack?
No.
No? Excellent. Do you smoke cigarettes on a daily or weekly basis, or have you quit smoking in the last 6 months?
Yeah.
Yes or no?
Yeah. That's no.
You quit smoking?
Yeah.
Okay. Well, longer than 6 months ago.
Yeah.
So you're a non-smoker.
Yeah.
Okay, very good. All right. How would you describe your current physical activity or exercise levels? And we're talking cardiovascular.
Minimal.
Yeah. Okay, so would you consider yourself sedentary, light, moderate, or vigorous?
Light.
Oh, light.
Yeah.
Not sedentary.
Oh, yeah.
Okay, well that's pretty much non-existent exercise.
Yeah. No.
Alright, sedentary. So frequency is none per week.
Yeah.
Duration, none per week. No, okay. Alright, so because your current physical activity level is under the recommended guidelines of 150 minutes per week, we've got to give you a +1 risk factor here.
Yeah.
Okay, and your height is,
170.
okay, weight,
79.
okay, so we've already worked out that that gives you a BMI of 27 kg per metre squared.
Mm-hmm.
And because it's under the risk factor of 30 BMI, that's great, so no risk factors there.
Mm-hmm.
Have you ever been told that you have high blood pressure?
No.
Have you ever been told you have high cholesterol?
No.
Have you ever been told that you have high blood pressure? Oh, sorry, blood sugar.
No.
High blood sugar, right. Okay, so we'll tally those up, and that is +2. Risk factors. A couple more questions. Have you spent time in hospital, including day admission, for any medical conditions, illness, injury during the last 12 months?
No.
Are you currently taking your prescribed medication for any medical conditions?
No.
Are you pregnant? Well, I hope not.
No.
Do you have any muscle, bone or joint pain or soreness that is made worse by particular types of activity?
No.
Right. Okay. That's great. Alright, so we're just going to go through the risk stratification. Okay, so we've got a total of 2.
Mm-hmm.
And because your risk factor is 2, it puts you at a moderate risk level. So individuals at moderate risk may participate in aerobic physical activity or exercise at a light or moderate intensity. And I'll just show you on the table. Yeah. So you can exercise up to a moderate, light to moderate intensity, which means you can exercise up to 70% of your heart rate, maximum heart rate.
Mm-hmm.
At a moderate to somewhat hard rate of perceived exertion. Okay, excellent.
Mm-hmm.
So, because of the answers given to me today, I feel that we don't need to refer you for medical clearance at this time, and you're able to participate in light to moderate exercise starting today.
Okay.
Okay, great.